I do know that it's been reported from the health officer that the Talbot patient has been released and is back home. And of course, our thoughts and prayers are with the patient. We hope that the patient is resting comfortably and is getting the attention and the medical attention that they need. Regarding testing, again, as I mentioned, we have Shore Regional Health on the call every morning, along with Choptank Community, and as well as Anne Arundel Medical Center, and they do give us a breakdown on the number of calls, a number of tests that they're taking every day. I do have yesterday's numbers now, and these numbers are 24 hours old, so these are not current date numbers as of March 20th today. Reporting out yesterday, Choptank Community Health reported 31 tests, 12 being negative, 19 pending. And that pending number is big, as we said before. Shore Regional Health, Shore Regional Hospital, I should say, took 74 tests. The one positive that we know about, the patient that was just released, 12 negative, 61 pending. We're still in this 6 to 10 day turnaround time from the time that the swab is taking its place in that media, which is that valve that is then sent up to either LabCorp or LabQuest, or whatever company is doing the actual matrix on that sample. Anne Arundel Medical Pavilion here in Easton Monday will start their mobile testing. So they have the equipment, as we talked about before, having that media that keeps the virus alive. So they have enough of that to go ahead and start a mobile testing site. Now, that will only be for patients within the Anne Arundel medical system. So you must be within their system network in order to come out there and get tested. I believe you also must have a prescription from your doctor or a note from your doctor to have that test done and have that test performed. They have 60 kits there on hand, so we'll watch that number and see how many they do. Today, up at Chesapeake College, they did the testing in Queen Anne County. The same thing that was done there. You had to have a doctor's note or a prescription from your doctor to go up and do that test. You didn't have to be in any one particular network. So if you were a Talbot County resident, but you were in Blue Cross and Blue Shield, and you had a note from your doctor, you could have gone up there today to have that test. I believe they're going to do their test, their mobile testing on Monday, Wednesdays, and Fridays. So a little bit different from what Anne Arundel Medical Center is doing here. Choptank Community Health, they're doing mobile testing in 5 of their 6 locations in the Mid-Shore region. Again, you must have a note from your doctor in order to go and have that test done. What you want to find out is if your primary physician can kind of rule out some things ahead of time. Is this a regular common flu? We're in flu season right now, so this may be the common flu. And if it is, he can say, well, this is what this is. We don't need to have him go get tested for COVID-19. Is this strep throat? I mean, there's been a number of cases of strep throat right now. Is this a touch of maybe bronchitis? So we want to have some things either ruled in or ruled out. And if we know that it's not bronchitis, it's not strep throat, it's not the flu, type A, type B, then we can probably look to having that secondary test done, which is the COVID-19 test done. We were at the meeting early this morning. I got a phone call from Jamie Winden down in St. Michael's. Of course, she's CEO of Winden Distilleries. They are now switching over. They got the FDA approval to switch over from making spirits to making hand sanitizer, which we're running short of here in the county. She called me on the phone and said, hey, Corey, we want to do this. We're short on hydrogen peroxide. While I was sitting there on the call, I stopped and said, hey, we need hydrogen peroxide. Can anyone get their hands on any hydrogen? And just that quickly, I'm getting phone messages in and said, hey, I know we can get some. Where do I need to drop it off? She said, hey, I need some glycerin. Stop the call. Hey, we need glycerin. I know I can get some. How do I get it over to her? And just that quickly, in a matter of just talking around the table, she got the supplies that she need to go ahead and start the production of the hand sanitizer so that we can get that back into production here in Talbot County for our first responders to use. And so that's just the wonderful power of people. And when they have the passion and the desire and the will to get it done, we can get it done. When we talked about doing the childcare sheltering for our essential and mission critical personnel here in the county, to watch, Kelly Griffins at the school say, hey, well, we can use the elementary school, the old Crystal Atkins part of the building, because that's not being used right now with schools being shut down. And Dr. Wiley said, well, the Bay Street location is available because we're not doing a pre-K there. That's been shut down. And then Robbie Gill calls me on the phone and said, hey, look, we want to help out. We have some space over here. We can also help out over here at the YMCA. And then now that we had the space available, how do we feed the kids when they come? Well, CarePac steps up and say, hey, well, we'll feed them. And Kelly said, well, we have some grant money through our initiative with the school system. Everything just started coming together, and people just started working together, and it was just a beautiful thing to see. We had someone today bring in a basket full of masks. I wish I had my coat with me right now and I would show it to you, because that PPE, those personal protective equipment, are somewhat short supply. Well, there's a quilting group that's out there here in Talbot County. They quilt, and they did about a dozen of these designer masks and brought them over to the EOC. And they were just beautiful, and we're going to order like 50 more from them to hand out to our first responders. So great. I mean, it's wonderful to watch that happening, and the level of. And I knew this was always here in Talbot County. The volunteerism has never ever been hard pressed in the county. Whenever there's a need, people step up. But to watch it, when there could be some personal risk, let's face it, when you're volunteering with something like this, there is some personal risk involved with it. Let's be real about that. Yeah. Well, I mean, there's so many balls in the air, with this, and looking at what the next governor's decision may be, what the next decision may be from the White House. So we got to keep our eye on that, while also looking at the needs here at home. We talk about how to feed these children who are maybe food insecure at their home, and making sure they have proper nourishment, making sure that our first responders have childcare for their children, making sure that we have just enough hand sanitizer and equipment to go around, making sure that we keep people paid, keeping our teachers paid, making sure that we're keeping a good open communication with our business community. Cassandra Van Hooser from our Tourism and Economic Development, and Sam Shogay, who we're going to be losing at the end of the month, but he's still there every day. He's still part of the mission critical movement of Talbot County, to making sure that we're talking to our business community, we're talking to our Silverstein from the Chamber of Commerce, we're talking to our town representatives to find out, hey, what can we do to help out with our business community? Another thing that we're rolling out is the Talbot COVID-19 faith website, faith number, where you can call into and talk to someone as we're going through this very trying time. This is the Rare Hope, where we're calling it the Talbot COVID Rare Hope Hotline. So you can be able to call into that number to speak with someone from the faith community, just to have a frank and relaxing conversation about what you're going through, what you're feeling. Yes, something like this can cause an awful lot of stress, awful lot of anxiety. And if you're someone who is more of an extroverted personality, you're used to going out and doing things in restaurants and so forth, and now you find yourself stuck at home, that can be very daunting on you. So, yeah, we want to make sure that we also address not just the physical man with food and shelter, but we also address the spiritual and the mental man through our mental health and our faith community. So